Just need to identify the big one, which is at the back, is the gluteus maximus. Okay. Medius minimus generally we won't ask you because we won't, it will be confusing for you to identify at that point. Maybe these things also no need. So at least you need to identify the gluteus maximus, two actions, nerve. So gluteus maximus over here, gluteus minimus, maybe all these, don't worry, these things are just some exercise we did during class. Intramuscular injection, these things. In the front, in the front of the thigh, what you need to know is these things can be asked, right? So in the front, you see the one which crosses from lateral to medial. This is a left leg, left thigh. So from the lateral to from lateral to medial, the one which crosses will be the sartorius. The muscle which is in the front of the thigh, the bulky muscle in the front, will be called as the quadriceps. But when we say quadriceps, it means it is made up of four muscles, four different things. So the one which runs straight, this part is called the rectus femoris. So this is rectus femoris. And if you lift that rectus femoris, you see this, in this case, this is a right side one. So this is a sartorius and this muscle is rectus femoris. If this is rectus femoris, so quadriceps includes rectus, this muscle. What is this on the medial side? This is vastus medialis. What is this muscle? This is vastus lateralis. When I lift this rectus femoris underneath, I'll be finding the vastus intermedius. So vastus medialis, intermedius, lateralis, three muscles plus this rectus femoris, all four put together, they form the quadriceps femoris. In addition, this triangle is the femoral triangle. So in the femoral triangle, this is inguinal ligament. This is not the boundary. This is the boundary. This is adductor longus and this is sartorius. This boundary is the femoral triangle. Okay, sartorius, rectus femoris, vastus medialis, vastus lateralis. What is this? This one? Vastus intermedius, because we have removed these rectus femoris over here, and this muscle which is in the middle is the vastus intermedius. Okay.
Doctor,
Yeah.
we can see your slide.
Come again, please.
We can see your slide.
Oh, sorry. Automatically it has. Yeah. Just I can see now. It has come out of the sharing. I don't know how. It's okay. For the whole of lower limb, you didn't see?
Yes.
But I changed. Okay. Guys, what were you doing? At least now you had a thing. Okay. I thought I saw the red line or something, then I totally missed it. Sorry about that. See, this gluteus maximus, you guys need to know. Once you come back, these things, don't worry about all the other things. So this is gluteus maximus, you need to know. Okay, in this case, this is the front of the thigh where the long muscle over here is the sartorius. Then you have all the bulky muscle in the front, all put together. It is called the quadriceps, in which the central portion is the rectus femoris. Then this is the vastus medialis. This is the vastus lateralis. And then you can see in the middle, right? Once you remove the rectus femoris, the one which you see over here, this will be the vastus medialis, vastus intermedius. Okay, this is vastus intermedius. Now, now this medial compartment, it will be difficult in this case. You see, I'm not sure will be efficient, but the one what you need to know is this gracilis, the one which is bigger here, and that's all we'll ask you. Gracilis identify, maybe adductor longus, yes, along with the femoral triangle. Other than that, not much. Don't worry about these things. Magnus also, it's okay. This femoral triangle, please go through. Maybe if at all some questions are being asked, they can ask you in femoral triangle, not more than that. Now, femoral triangle, popliteal fossa, cubital fossa, even for OSPE and for theory, these are the most important high yield topics. Okay, generally these are the ones which will be repeated quite often. Okay, so in the femoral triangle, from medial to lateral, vein, artery, and nerve. Not much. Don't worry, femoral sheath. No. Posterior compartment, there are three muscles, right? All three put together, you can see all in one slide. You can see these are the three muscles, all three muscles supplied by one nerve. Even all the front of the thigh muscles, they are all going to be supplied by femoral nerve. Front of the thigh, femoral nerve. Back of the thigh, sciatic nerve. Medial compartment of the thigh, obturator nerve. Medial compartment, adduction of the thigh. Okay, so remember, when a muscle cross a joint, it causes movement at that particular joint. Okay, don't spend too much time worrying about all identifying all the muscles, remembering all the actions. Don't waste your times. Find the big like these muscles what I've told you. One action, uh, you if you can possible try to remember the nerves which are going to supply them. Those are the maximum. We'll ask you action and nerve supply, right? So maybe clinical importance or something, but usually the important ones which we might have discussed during sessions, those are the ones we normally ask you. Okay, so I think in all this, gastrocnemius is the one which you need to know. Under the cover of gastrocnemius, soleus is there. Okay, these are the two muscles which you should remember. Gastrocnemius, under the cover of gastrocnemius, you have the soleus. Okay, popliteal fossa, just the boundaries. You see this diamond shaped opening here. And what are the contents? All popliteal artery, popliteal vein, and there are two nerves because sciatic nerve is going to divide into common fibular and tibial nerve. So common fibular, as you know, it is going to wind round the lateral uh, this neck of fibula. So you can see this is the common fibular nerve. I think that's all. Arteries, don't worry. Like maybe in this case, femoral artery in the front. When it goes back, it is going to become the popliteal artery in the popliteal fossa. Other than this, in your OSPE or this thing, they are not going to ask you anything. Veins also, most probably, they don't ask you. Okay. That's all from this topic. Because if I go into proper revision into whole thing, I'm not sure because it's going to be again like lecture, you would have forgotten, but please focus on these important points and you try to remember about the lymphatic system. Um, my topic lymphatic system this time, this maybe what you need to know is how lymph node, you will have a capsule, you will have cortex and medulla. And in the cortex, you have I'm not sharing any slide, I'm just letting you know. You have in the cortex, you have superficial and deep cortex. Okay, that's the most important points you need to remember. As far as spleen, there is no cortex, medulla, or nothing. There will be a capsule. Underneath the capsule, the whole thing area is going to be divided into red pulp and white pulp. And if it is a red pulp, it is going to be red. White pulp, it is going to be, it is kind of a lymphatic nodule, right? So it is going to be all bluish colored over there. But one special feature which distinguishes the splenic nodules from all other lymphatic nodules is it has a central artery. So presence of central artery, red pulp, white pulp, covered by capsule, splenic sinuses and all these things. These are the characteristic features you need to remember about the spleen. What about thymus? Thymus will be covered by capsule. The substance is divided into cortex and medulla. In the medulla, the most important point which you should remember is the Hessel's corpuscles. These are the important points about each of these things. If you remember these things and if you know how to identify, that's all. These are the three ones. So palatine tonsil, don't very much, but these are the three ones which, if at all asked, they are the ones which can be asked. Okay. I don't think I had any session in endocrine, right? Maybe Prof had this development. Am I right? In endocrine, Prof. Miyothan or who had this development of if it is if if someone else has taken, then it's okay. Yeah. Oh, then it's okay. Yeah. Then it should be fine. Maybe generally you need to in development you need to remember which arch, which this thing or pouch, which pouch leads to which one development. Those are the normal ones they ask in development. Other than that, development of pharyngeal pouches, that's the only one you need to know. And about each organ, maybe later they'll let you know. Whoever has taken, they would have let you know. And as I've told you earlier, in endocrine, you won't be getting any OSPE from anatomy. There will be two OSPEs, but nothing from anatomy. Okay, guys, maybe I'll ask Prof. Tinmo to join. Huh? Is there anything else you want to ask me? In this, I think in MSSK, as far as MSSK is concerned, you should be because mostly MEQs are going to be about bones and these things. So concentrate on them. As I've told you, you need to know a bit about vertebrae, a bit about the bigger joints in the upper limb and lower limb, like shoulder, hip, elbow. These are the three major ones, and as a knee as well. Shoulder, shoulder, elbow, hip, and knee. At least basically, what are the bones taking part in them? What kind of development of pharyngeal arch is my topic, is it? Okay, then okay. What are you? Wait, 1 second then. Yes. 1 second, just give me a minute. Okay, I'll just share this one.